here finally. That's awesome. I'm just trying to get onto this screen, the other screen that I'm supposed to get on. So I'll show my face in a minute here while we warm up. Um, but thank you, everybody. First of all, it's super exciting to celebrate World Kidney Day with all these eminent dietitians from all over India. I first would like to thank everybody for being here. Can you hear me now? Unmuted. So the camera is here. It's coming here. I am sorry. Just give me 1 minute. There is some technical glitch on the. I'm just going to fix it. Okay. Can you see me now?
Yeah.
All right. No, that's the main camera.
Ja.
Can you all mute yourself, please? Can you hear me?
Yes.
Yes, you are audible.
Okay. Thank you so much. Yeah, Penda. Okay. Welcome, everybody. On behalf of NutriHealth Foundation, I would like to welcome you all for this World Kidney Day panel discussion on renal nutrition. First of all, I would like to thank our panelists for being here. Dr. Zamrud, Dr. Kanika, Dr. Epsita, and Dr. Vijayashri. In a minute, we are going to pin all the speakers on the screen so that we can see all of them. And then we will go ahead and get started with the panel discussion. So I'm just going to run through the agenda real quick. What we are going to do is, first we are going to introduce our speakers because we definitely want to know who they are and we want to hear about all the great work that they have been doing in the field of renal nutrition in India and all over the world. And then we are going to go topic wise. First, I would like to start with nutrition through disease progression, and Dr. Zamrud will be taking some questions on that. And once we are done with the disease progression nutrition, then we are going to move on to the impact of nutrition pre and post dialysis. So we are going to have Dr. Kanika answering those questions for us on the panel today. And then once we are done with that, we are going to move on to the Dr. Vijayashri, who's going to answer some questions on kidney stones and prevention through diet. And also, once we are done with the kidney stones, we're going to move on to our last but not the least topic, kidney transplant nutrition, which is absolutely important. And we are going to have Dr. Ipsita answer some very interesting questions for us in that discussion. So that's the agenda for today. We are running a couple minutes late here. I'm sorry about the technical glitches. How much ever, I guess we try to have everything ready and planned, the last minute glitches always come up. And I think as dietitians, we very well know how to handle these last minute issues, because we keep doing that in our practice day to day life. So this is not new for us, and we can handle this very well. All right, having said that, I am going to introduce our panel members here. Uh, Dr. Zamrud, thank you so much and welcome to the panel. I would like to thank you on behalf of NutriHealth Foundation for being here. I'm going to look at both the screens, so if I am like looking here and there, it's because I have two screens in front of me and I'm trying to move between the screens. And that's one of the technical glitch as well, and I'm doing my best to manage that here. It is not supposed to be like this, but yeah, I'm going to work through that. Dr. Zamrud is a chief dietitian and HOD at Glen Eagles Hospital, Mumbai. And she's a leading renal dietitian and educator with extensive clinical experience in chronic kidney disease management. Dr. Zamrud has been a chapter convener for Indian Dietetic Association Mumbai chapter, and she has been faculty guide for graduate and postgraduate students at SNDT University Mumbai, and she is a recognized speaker at both national and international medical conferences. That is amazing. Some of the awards that she has received a distinction award for excellence in nutrition practice in 2020 at district level, and then she received a quality award for excellence in medical nutrition practice in 2023 at state level, and she also received quality award for excellence in public nutrition in 2025 at state level as well. That is amazing achievements, Dr. Zamrud. And she also has some of the publications that we want to mention here today. She's been a co-author of the book called The Purple Book, a handbook on diets and diseases. And she also published research on low-protein diets for CKD management in BMC Nephrology and Journal of General Medicine. Thank you so much, Dr. Zamrud, for being with us today here. It's a pleasure to welcome you on the panel. Thank you. And next, we have our next speaker is Dr. Kanika. Dr. Kanika, welcome. Thank you so much for working through the technical glitches with us at the last minute and being on the Zoom with us today. Dr. Kanika is a registered dietitian as well. She is deputy manager and HOD in dietetics department in the Krista Apollo Hospitals in New Delhi. And she's a renowned clinical dietitian and researcher with a strong focus on pediatric and renal nutrition. Dr. Kanika is a certified diabetes educator with multiple ISPN LLL certifications in ICU nutrition, liver and pancreatic disease, obesity, and metabolic disorders. That's wonderful. And she is a trained she's trained in dietary management of inherited metabolic disorders and low FODMAP diets for IBS. She's executive member of IDA Delhi chapter and core group member of pediatric nutrition, IAPN. Some of the awards and recognitions that Dr. Kanika received, she is the author of book chapters on cardiovascular diseases, obesity, and pediatric nutrition. And she has been a speaker at national and international platforms, including FICCI, HMA, IDA, Apollo Innovation Award, and IAPE and ICLC. That's wonderful achievements, Dr. Kanika. So glad and happy that you are on panel with us today. Welcome to the panel discussion.
Thank you.
Can you see us? Dr. Kanika, can you hear and see us?
Yeah.
Okay. All right. So next we have Dr. Vijayashree with us here. Dr. Vijayashree has wonderful achievements again. All our panel members today are really very, very accomplished, and I feel a lot of pleasure to introduce you all in this panel discussion today. Dr. Vijayashree is also a registered dietitian, and she has been head of dietetics department in MGM Healthcare and MGM Cancer Institute in Chennai. I was talking to Dr. Vijayashree last week, I believe, and I was amazed with the kind of work that you are doing in your hospital. It's wonderful. All the new innovative things that you are doing there. And she has about over 18 years of experience in clinical nutrition. She's specialized in renal, pediatric, ICU, and cancer nutrition. It's wonderful. And some of the accomplishments of her include she's expert in nutritional policies and procedures for organ transplantation, critical care, and pediatrics. And she's accredited by NABH, JCI, and QAI with significant contributions to digitalization in nutrition management. That's wonderful and so needed. She's been author of multiple nutrition guidelines and recipe books, including Cancer Food Guide and Food, the Miracle Medicine. Some of the awards that Dr. Vijayashree received are Dr. NGR Health Champion Award in 2024 for Excellence in Nutrition and Excellence in Nutrition Practice Quality in Digitalization and Dietetics Award in 2023 by ICNC Chennai and Healthcare Provider Award in 2024 for Menstrual Health Awareness Initiatives. The publications, some of them that she is involved in are the research. She is involved in a lot of research on CKD patients, CAPD patients, and geriatric cardiac rehabilitation that has been published in Kidney International Reports, Journal of Renal Nutrition, and BMC Nephrology. She's been faculty and speaker at many national and international conferences on nephrology and medical nutrition therapy. Welcome, Dr. Vijayashree. It's wonderful to hear about your achievements, and I'm super excited to get your thoughts on the panel.
Thank you.
Yeah, so last but not least, we have Dr. Ipsita. So excited that you are here, Dr. Ipsita, with us. Dr. Ipsita is also a registered dietitian and she is head of dietetics from CMRI Hospitals, Kolkata. She's a renowned renal nutrition expert with over 25 years of experience. That's amazing. And she's been previously associated with Fortis Hospital, Wockhardt, and Bellevue Clinics. Amazing. She's been a former general secretary from 2011 to 2018, and she's a current national treasurer of IDA. She's a member of IAPN's Renal Nutrition Core Group. She's also been a member of ESPN and ISPN and other national and international dietetics organizations. She holds about 14 LLL certifications, wow, from IAPN and ESPN, along with an advanced certification from American Academy of Continuous Education. Congratulations, Dr. Ipsita. This is wonderful achievements. She's been awarded Sadhna Award for Lifetime Achievement in Nutrition and IAPN Excellence in Clinical Nutrition Practice Award as well. Dr. Ipsita has been a contributor to various research studies, books, and media articles in Bengali, Hindi, and English. Dr. Ipsita has been an active speaker at many conferences and academic institutions on renal nutrition. Thank you so much for being here, Dr. Ipsita. All right, that's about all our wonderful speakers. It's amazing how accomplished each of you are, and I am super excited and looking forward. And without any further delay, we are going to jump into our questions. Maybe the questions on transport. I promise we don't operate this way every time. We are just having too many technical things with the devices here, so we are trying to maneuver through this. Please give me a minute while I pull out the questions that I had. So while we are getting started, Dr. Zamrud, I would like you to start. I would like you to get started. Who's this? Dr. Samrat?
Yeah.
Okay, so while I am pulling out the questions, I would like you to just give us a brief overview on how important the medical nutrition therapy is in disease progression of CKD in general.
So, kidney is a very intelligent organ. And when there is a disease to this intelligent organ, nutrition plays a very important and significant role in preventing the progression of the disease and also preventing the metabolic complications that arise from this disease. So, if you're talking of medical nutritional therapy, it is the key treatment in patients of any form of kidney disease. And when you're talking about what should be the types of nutrients, so basically, if you're looking at when we are talking of medical nutrition therapies, the macronutrient that's most important, I don't say protein, I say is calories. Why? Because today we see a lot of malnutrition in this population, and as Indians, we do not eat that much amount of protein. But the second nutrient that has to be spoken about is proteins. So, calories are important, proteins are important, your electrolytes are important, your minerals, calcium, phosphorus is important, and fluid is important. One important nutrient that we all tend to not calculate in kidney patients is fiber. And today we know the significant role of fiber. So probably if you're looking at a diet for a kidney patient, it has all the elements that would be there in any other diet. But
That's
yes, you have to know the ratios that you have to add to this diet and how what are the calories going to come for you from.
right. That's so true. That is so important, especially the fiber part that you touched upon, Dr. Zamrit. I think that's something that we don't consider very much when it comes to nutrition in renal patients. And we will get into the details of the fiber in a second here. So to begin with, I just want to start off with one question. So what are some key considerations regarding sodium and fluid intake at the first early stage of CKD that you would suggest?
So ideally speaking, in the first and the second stage, most of the time the patients do not reach the nutritionist. Today, there are a few cases that we do see, but it is mostly that we start seeing patients at stage 3, right? And in this stage, it is not that all people having a kidney involvement would require modification for fluid, but definitely modification for salt and sodium would be needed. Now, how much restriction have you to imply to these people will depend upon what is their actual intake. So the prescriptions needs to be individualized when it comes to your prescription for salt or for fluid. Probably there would be somebody who has a urine output and may not require a fluid restriction, but salt definitely needs to be restricted in all patients having chronic kidney disease. So
Yeah.
whether it's stage 2 or 3, you would have to give some amount, mild amount of salt restriction. It
Mhm.
has to be a low sodium diet, and the fluid management will depend on other factors which are present.
Hmm. That's right. Yeah, I mean, you are so right. In stage one, two, especially at that stage, you won't even see them
Yes.
uh, seeing a nutritionist, and that's a biggest challenge. I think there's a lot of awareness and education that we have to do that as soon as, even with the nephrologist, as soon as a patient comes into their clinic with a CKD problem, dietitian has to be involved in the team so
Yes.
that right nutrition can be from the forefront, and then you're not dealing with when it is already at a stage where you really have to do stringent modifications in the diet and all of that. So that's so important. And coming to our next question, is there a evidence, you touched upon fiber. So is there a evidence that plant-based diets can benefit, CKD patients in early stages? I've been seeing a lot of research going around. And yesterday, in fact, I attended a meet on kidney diseases here, and that was one of the topics that was presented with plant-based diets. And it's so
It is,
important.
it is important. So
Yeah.
plant-based diets have shown benefits in people with having kidney problem.
Mhm.
And plant-based diet basically are the ones which will reduce your metabolic acidosis. They will reduce the load on the functioning kidney. So basically, we understand that when you eat more protein, the type of protein also is important. When you eat the non-vegetarian protein, it causes more of the dilatation of the afferent arteriole and constriction in the afferent arteriole, which increases the intraglomerular pressure. Thereby, this increases the load and there could be proteinuria and progression of the disease. Whereas when you're taking plant-based diets, this phenomenon is not seen. At the same time, the utilization of the plant-based protein has been seen and it is benefiting. In fact, if you look at Indian population,
Uh-huh.
predominantly the Indian population is vegetarian. So I
Yes.
think these diets are useful for our population and we should be focusing on them. Other than that, even
Mhm.
these plant diets are lower when it comes to the phosphorus absorption. People do have a worry when you're using a plant-based diet for potassium, but I think if we clean our vegetables well, that is the leaching process, and if you're
Yeah.
using, I don't see potassium would be a challenge on plant-based diets.
Uh-huh. That's right.
Yeah.
So yeah, especially fiber. And did you come across any research on acidosis? The
There
acidosis.
are papers which say that metabolic acidosis is reduced when you use plant-based proteins. There are number of papers, and
Yeah.
it has a beneficial role. In fact, if you see in the third stage three and patients that we see, normally our
Mm.
population is plant-based diet-based population. Okay, people eat very less non-veg. At least the
Yeah.
population that I see do eat non-veg, but
Right.
I have seen a better role of this proteins utilization wise also. And
Mhm.
again, giving some sufficient amount of fiber, because you know what happens in this population is, as we were talking of the fluid restriction. So when
Yeah.
there is fluid restriction, normally people get dehydrated and they do have constipation. So when you're using a plant-based diet, probably the fiber portion is also coming in. And
Mhm.
you're able to help the people to not get into this constipation, and metabolic acidosis can also be corrected. So
Right.
you see, proper utilization of protein actually happens.
Yes, yes. Do you use plant-based proteins? Do you in the hospital where you are? Is that
Yes,
something?
we do, our diets are basically vegetarian diets. We do use a little dairy, and probably, I mean, I would not say that we do not, if somebody who's a non-vegetarian, we do not remove the non-veg protein until it is his wish that he wants to remove it. He does not want to continue taking it, then probably we may change the diet. But most of the time, we find that our diets are predominantly plant-based only. Of
That
course, some amount of dairy would be there. It's not
yeah.
100%. But if you see literature, it says even if 50% of your protein intake is plant-based, it really helps in preventing the progression of the disease faster.
That's right. That's right. That is amazing. It's such a close topic to my heart about plant-based diets and how it helps in different disease progression, not just renal. It's amazing to hear what you're saying, Dr. Zamrat. So moving on to our next question, I'm going to step up a little bit into the advanced CKD stage, and what I would like to know from you is what are some of the best strategies to prevent malnutrition in patients with advanced CKD? Because that's something that we see a lot. Like you just said, patients come to us when it is too late and they are malnourished. They are, they hardly have any muscle mass. So, what are some of the best strategies out of your practice that you would recommend for somebody who comes to you with a malnutrition CKD?
So probably when this patient first comes to me, I follow my nutritional care process. I first do the screening and assessment, then I do my calculations, then I put them on the diet plan based on what are their preferences and make an individualized diet plan approach. So probably when I do my calculations for the diet, we calculate how much is the calorie intake, what is the protein intake. Normally
Mhm.
with advanced stages of chronic kidney disease, the recommendation of diet is a low protein diet, which could be only a low protein diet, which would be between zero point 0.6 to zero point 0.8 gram of protein, or it could be a supplemented very low protein diet where you use keto analogs of essential amino acids with a very low protein diet. So
Okay.
probably before you put people on these therapies, what is most important is your assessment. You first need to understand what is their baseline intake. So probably if somebody has a very good nutritional status, has a very good appetite, but has a progression of the disease, then
Yeah.
probably these candidates, I would try to use a supplemented very low protein diet. But somebody who does not have an appetite, does not have that much of a good nutritional status, probably I will first assess and see what is his baseline intake. If he is fitting in the category of zero point 0.6 to zero point 0.8 gram of protein, I will start working to build his calories, to
Right.
use, calorie dense foods for him. And
Mhm.
when to do this, I would also use the 24 hours urea nitrogen appearance method to be showing in black and white that what is exactly the protein intake of the person. I can definitely do it with the diet diary, but if I do it here, objectively, subjectively, I am thorough that what my patient is actually eating. So that's very important for me to understand. And based on that, then I make my plan what type of therapy I'm going to use for my patient, because I want results. I want my patients to
Exactly.
comply with the diet. That's very important for me. So if they are going to be following if they have to follow the diet, it has to be close diet to his regular pattern. So
Mhm.
I think individualizing the food patterns for them and developing more foods which would be more friendly for them,
Mhm.
working around with recipes for them, making the food more palatable for them, and making it more to his regional taste. I think that is something that you really need to do so that you can prevent malnutrition. Because ultimately, you have to remember these people are going to progress towards end stage and they have to need renal replacement therapy. So their
Yes.
nutritional status has to be good.
Yeah, yeah, that is so important. Like, the assessment, and more so of making it very practical and easy to follow for them, to give them the recipes, to teach them how to, follow these simple things that can get maximum nutritional benefits out of the diets that they are eating, rather than putting them on exotic foods and telling them to do things that are really not practical. You rather look at their overall lifestyle and provide them with
Correct.
some sessions that are actually working for them. And that's, as a dietitian, I think it is on us, how to educate them and empower them and create that awareness among people. Because when they come to dietitian, they expect us to give this entirely completely different diet chart that they would like to see. And they don't realize that it is not about, giving a diet plan for them. It is about the plan that works for them. And you stressed very well on that point, Dr. Zandra. Thank you so much. I actually would like to see if any of our other panel members have any thoughts on this. Please feel free to chime in, and we can make it more productive. It doesn't have to be like, one-on-one questions or anything. But if any of you have any input about the disease progression nutrition, Dr. Zamrit has been amazing in answering questions. If you would like to add anything to that, the plant-based diets or, the malnourishment, that'll be great. Did I hear anybody?
You're muted,
Hi.
Petra.
Hi, ma'am. I just want to share,
Hmm.
like we are actually doing a study on a CKD population who are not on dialysis, the
Okay.
stage 1 to 3,
Hmm.
and we almost completed 120 samples
Mm-hmm.
using a body composition analysis and other nutritional assessment tools.
Hmm.
So it is, we found almost more than 50% of them are having a very low muscle mass
Wow.
already in the stage 1 and 2. So this
More than
is,
50%.
yes.
Wow.
And most of these people are following some kind of restriction told by many physicians,
Hmm.
general physician and other whoever they are meeting. So the
Right.
by the time they come to nephrologist, and nephrologist refer to dietitian, so they are already malnourished. So
That.
yeah, we are already, they have a lot of restriction,
Hmm.
and we have limited source to offer them. So that is what, as ma'am said, the dietitian should be involved in the very first appointment with the doctor. So that is very important. So we have to spread awareness about it.
Yes. I mean, we can't stress more on how important it is to have registered dietitians on board. It's very important to form that team with the nephrologist and to have their buy-in, and then make sure that we make that, that connection with the nephrologists, and then come up with plans that actually work for the patients rather than working against each other. We should work in coordination with these doctors, and come up with best forward solutions for the benefit of the patients. That's amazing. Thank you so much for sharing that, Dr. Vijayashree. That's so profound. 50% of them being malnourished. That's so much work for us to do there. Anyone else has anything to add, Dr. Kanika or Dr. Ipsita?
In my part of the country where I practice, basically this Bengal area, Kolkata, there is a non-veg eating habit is more pronounced, you can say. So as Zamrud was saying that that part of the country was mostly vegetarian population is there. So in our country and in my side where I practice, unless otherwise patient refuses to have non-veg, patient usually takes a portion of non-veg. So where protein intake is being catered by the non-veg intake. And here what Zamrud was saying regarding the fiber intake, there we need to counsel the patient regarding the importance of fiber and how you can, because as you know, in stages 1, 2, 3, and 4, like in those cases when urea creatinine a little on the higher side and patient don't feel like eating anything, they are nauseated, they have an azotemic nature, by nature they become that. So there we face that consequences because they just simple rice and little bit of fish, that much is sufficient, or maybe a bowl, I mean a small portion of curd, that will do. So their fiber intake is a challenge in our part of the country.
Yeah, that is true. I mean, I think overall that's one accepted fact that fiber intake is a bigger challenge when it comes to, the renal patients, and that's where I think the plant-based more.
Because by the time they are having those, they are almost full. They don't want to eat something extra, or for fiber, they don't want to eat extra vegetables and all. So their fiber sometimes becomes a challenge in our part of the country.
Yeah,
I think
yeah.
everyone we are facing the fiber in other concept also, because there are so much restrictions is there, like potassium restrictions, and the main source of fibers is fruits and vegetables, and
Yeah.
they are also restricted in their diet because of the potassium level and all. So this is
Yeah,
a
leaching
challenge.
can be done, like for vegetables, we can give potassium, I mean, those vegetables also. So that's not a problem.
No, leaching is definitely done, but she mentioned is right actually, because how long to leach, how much
Absolutely.
water to take. So these are
That is not
questions
clear.
yeah,
Yeah.
exactly. Kanika, you're
That's
absolutely
not
right.
clear to them.
That's not clear to the patient. And then again,
Absolutely.
you have to give them those low, moderate, and high sort of grouping of fruits
The
and vegetables.
fruits and
When
vegetables,
you make
yes.
it and give it to them, then it becomes very easy, because most of them have to do the cooking themselves. And
Yes.
it may not be practical for all of them to actually do the leaching process. So many times
Exactly.
they restrict themselves, but at least they have some group of low and moderate fruits and vegetables which they can actually eat. Kanika is actually, that is also one
Right,
part.
but we want to give, sometimes we want to give because of the fiber, but we know their knowledge level is not up to date, so they can maintain the potassium level also.
Correct.
We are restricted there. Right?
Yeah, and as Ipshita said, people who eat like in that side, what she's referring is absolutely right. They do need that small portion of fish with their food. So for them, of course, it is difficult because the appetites are low. So on
Absolutely.
repeated appetite, then if you try to push little more, it may not be practical. So probably that is the space there you have to think of supplementation.
Supplementation.
Of the nutraceuticals available, which would play a role for such population. That's
Yeah.
important.
Yeah, that's where I think the role of
supplementation comes in.
It's very, very handy, where you can, have fiber supplements which are soluble and which doesn't add bulk to their diet. Again, the
Even
liquid.
they have fluid restriction, they have constipation issues. These all are there.
Yeah.
Yes, but there are a lot of supplements, fiber supplements that can be blended with the foods that are soluble. So maybe, you know,
Yes.
something like that. I know we are a little far away from the ideal situation of that, but I think that will be a really good idea to have the fiber need addressed that way. Ideally, we all want it through the food, but in cases like that, I think that is not a bad choice at all. Thank you so much. That's wonderful. I loved how we are all echoing to the same and rallying towards the same goal. That's amazing. So, Dr. Zamrud, thank you so much for patiently answering all the questions. I'm going to come back to you for another set of questions. But I'm going to move on to Dr. Kanika now. We have a time crunch on her, so I'm going to be a little quick with her, and then we will see how we can do with the question and answers and other things. Okay, here we are, Dr. Kanika. Okay, so we are going to, ask Dr. Kanika some questions on dialysis. Dr. Kanika, what are some of the common misconceptions about dietary restrictions for dialysis patients that you come across? So I know this is such a basic question, but it is so important that as soon as you say dialysis, a lot of misconceptions come in, and everybody has their own thing to say. So I would like to hear from you. What are some of the common misconceptions, and how do you address them in your practice for our young dietitians and nutrition students who are here?
Right. See, so many people have a misconception about the dietary restrictions for the dialysis patients. Oftenly, they assume they have to restrict their, they have to make a more restrictive diet or bland diet, right? But in reality, dietary guidelines vary based on the individual health conditions, and while some restrictions are necessary, so they are not as rigid as commonly believed. So one major misconception is like all proteins are harmful for them. So, right? So, however, while protein intake may need to be limited before the dialysis when they are on the stage 2 or 3, right? So,
Yes.
their requirement will be like 0.6 to 8 gram per kg. Once patients start the treatment or they are on the dialysis, their requirement will be more, right? So it would be like 1.2 to 1.5 gram. Okay, so the main misconceptions they have about the proteins. So sometimes what happens, doctors also forget to tell you now you have to increase your protein intakes. So
Yes.
when yeah, it happens many times. Patient came to us when they are on the dialysis. When we are counseling them for the proteins intake, you have to increase your protein intake. So they asked me, the doctor ने तो बोला है कि हमें कम ही खाना है, right? So we have to counsel them. Now you're on the dialysis, your nutrient loss will be more. So you have to eat. You have to increase your proteins, right? So another misconceptions, like they have to, like patient must completely avoid the fluids. So
Yeah.
while fluid intake should be carefully controlled to prevent swelling and high blood pressure. So total restriction is neither necessary or nor healthy. So it could lead to the dehydration also. So we see all these things sometimes. Okay, so dialysis patient may be advised to drink 1 to 1.5 or 500, 800. It will be depend on their conditions of the stage, right?
Yeah.
And so what is doctors is recommending to them. Okay, then other misconceptions may be like all fruits and vegetables are beneficial, but certain options such as like bananas, chicus, that are high potassium fruits and vegetables, they need to be limited to prevent the heart complications, right?
That's
So
right.
some people think that the like they also think like this sodium is also that mineral which has to be monitored. But with that, we have to monitor the phosphorus and potassium also. Okay, so because phosphorus can lead to the bone disease or vascular calcifications, while we are and with that we have to monitor the potassium, right? So, and other misbeliefs like dialysis removes the all toxins from the body, right? So,
Yeah.
so some people like कि एक बार dialysis हो गया, सब removes हो गया हमारी body से and everything is okay. No, but it can lead to other problems also when if you are not going for the dialysis on time, right? So dialysis patient must follow a well-balanced diet, which is tailored to specific their needs and as per the conditions. So by understanding the importance of protein intake, fluid control, and mineral balances, patient can make informed choices that help maintain their overall health and while complementing their dialysis treatment. So
Yes.
some misconceptions people have.
Yes, yes. Thank you so much. And you're so right. As soon as they say dialysis, it's like no protein, and you can't do this, you can't do that, and everybody would like to say something or the other. And then the doctor has his own set of restrictions that they give, and then and then they are not even seeing a dietitian in some cases, and that adds to another layer of misconception. So that's right. To address all of this. So, moving on to our next question, how does nutrition impact the effectiveness and the recovery process of dialysis? And what are some of the things that you would like to stress for these young dietitians who are with us from your practice, Dr. Kanika?
The nutrition plays a significant role in determining how effectively dialysis removes the toxins and how well his patient recovers after the treatment. So, advocate protein intake is essential to prevent the muscle loss and to promote the healing. So, maintaining controlled phosphorus and potassium level is also important as balances which can lead to the bone disorders and heart problems. So sodium intake must be monitored closely to prevent the excessive fluid retention, and
Okay.
which can also cause swelling and high blood pressure. So proper hydration management helps maintain the stable blood pressure during dialysis, and it also prevents the excessive strain on the heart, right? So patient also follows again, I will say, well-balanced diet and often experience the flu complications and improve the energy levels and better overall health outcomes.
Yes, yes, it is extremely important. So the role of dietitian is, again stressed, and we need to be in the forefront. We need to rally the message again and again that these people, not just when they are at the stage where they're going into dialysis or progressing through the disease. Please send them to us when they are entering into your office with stage 1 CKD. So that's the message we consistently want to keep giving out there. Thank you. And how does electrolyte balance and hydration play a role in dialysis nutrition? Can you share some experiences from your practice and also stress on how important it is to monitor and what electrolytes are we monitoring, pre and post dialysis?
Yes. See, maintaining electrolytes balance and hydration is very essential for the dialysis patients to prevent the further complications, right? So potassium level must be carefully regulated as high level can lead to like dangerous heart complications. So
Yeah.
while low levels can also cause a muscle weakness. So sodium intake must also be managed to prevent the excessive fluid retention, high blood pressure, and swellings edema. The phosphorus control is critical, right, to prevent the bone disease and calcification of blood vessels. So fluid intake should be carefully monitored, and excessive fluid can strain the heart and cause the shortness of breath sometimes, right? So while inadequate hydration can lead to low blood pressure and dizziness. So by maintaining a proper balance of electrolytes and fluids, dialysis patient can improve their overall health and reduce the further complications which can be happening. Fluid intake should be carefully monitored, and excessive fluid can strain the heart and cause the shortness of breath sometimes, right? So while inadequate hydration can lead to low blood pressure and dizziness. So by maintaining a proper balance of electrolytes and fluids, dialysis patient can improve their overall. What is happening? Reduce the further complications. It's repeating. Should be carefully monitored and excessive fluid can
Is
I
it
think it's
is
taking
it running by
repeating.
itself?
Why
Technical
it is
issue.
repeating? Yeah, I think there is some
Oh my.
connectivity issue.
Dr. Kanika, everybody loves hearing to you so much that it is just repeating by itself, the Zoom. I don't know. I am so sorry for this, but this should not happen.
It's in going on.
Yeah, it's going on.
Yes, still it's going.
Dr. Kanika, everybody loves hearing to you. So
I know, we do. We do hear, love hearing to you, but we would like to take the next question. So,
I think y'all are playing it on another, y'all are connecting through Zoom to other things, and that is the lag time, it is repeating itself.
Yes. We are logging from
Mhm.
two now. That's why
Yeah,
it happens, I think.
no, I think that's the closer.
love hearing to you, but we would like to take the next question.
Close the
So
whole thing.
Just a minute.
I think y'all are playing it on another.
now Zamrud has come in the picture.
All right. I think this is better. We have more than limit on Zoom participants. So we had a YouTube link that was playing in the background. That was the background that was playing that we could
Oh.
hear. Yeah. Yes. So that's thank you so much for repeatedly stressing on how important it is to have this fluid and electrolyte balance, Dr. Kanika.
Yeah.
We are going to the next question here. And how does this repeated dialysis process that, they are on this constant dialysis cycle, how does it impact their overall nutritional status? And what are some of the things that you have to, as a dietitian, monitor when the dialysis patients come to you at the regular, dialysis checks 3 times a week or how many ever times a week? How often do you monitor them? And what is the impact of this continuous dialysis on their nutritional status? And how, as a dietitian, we have to address those?
See, so like we all know the proper nutrition is crucial for the patients who are undergoing the dialysis. So as it helps maintain the energy levels and prevent the complications and support the overall well-being. So since dialysis removes waste and excess fluids and essential nutrients from the body, so dietary adjustments before, during, and after the treatments are necessary to ensure the optimal health, right? So, like if we talk about the before dialysis, patients should consume a light and protein-rich meals to sustain the energy and support the muscle health while avoiding the excessive fluids. So, high-quality protein sources such as eggs, lean chicken, fish, yogurt, tofu, which helps to prevent the muscles breakdown. A moderate intake of carbohydrates, so like whole grains, oats, which can provide the steady energy, right? So and additionally, limiting the sodium intake. We should avoid the processed foods and salty snacks, which can help to control your blood pressure and fluid retentions. So patients should also adhere to prescribe the fluid in limits to prevent the bloating and discomfort, which can happen during the dialysis, right? So a balanced pre-dialysis meal could include the scrambled eggs, whole grains, and the small servings of berries or nuts, something. And during dialysis, some patients may experience fatigue, dizziness, or low blood sugars, especially who are diabetic. So, to maintain stable energy levels, a small and nutrient-dense snacks is recommended. Okay, then options are like unsalted nuts in small amount and whole wheat crackers, low potassium fruits like apples, watermelon, grapes, and small protein bars, which can help. And patients are really like prone to low blood sugar, should include a small carbohydrate sources. Okay. So, and another thing is hydration, and it should be carefully managed while we can give ice cubes or chips, ice chips, or a small sips of water, which can help to elevate the thirst.
Right.
And if we talk about the after dialysis, it's replenishing all the nutrients is essential for recovery. So a well-balanced meal which is rich in proteins, so chicken, tofu, eggs, the high protein sources, which helps restore the muscle health, right? And
Yes.
complex carbohydrates like brown rice, our fortified cereals or something like that, which sustain the energy. And while healthy fats from almond butter, olive oil, or avocados, which are good for our heart health. So we can give that and also reduce the inflammation. So since dialysis affects the electrolytes balance, so patients should choose foods that help regulate potassium, phosphorus levels, and some cook like some green beans, cauliflower, low phosphorus dairies, but some alternatives should be given. Okay, and while fluid intake, we all know it should be monitored. Without that, we can't do anything. Like, so proper hydration remains important to prevent the dehydration. So by following these tailored nutrition guidelines, and dialysis patient can better manage their conditions. And they can maintain energy levels and support overall health, right? So
Yes.
working closely with the healthcares or dietitians, nephrologists, which can help to optimize the dietary choices, right? Which are obviously based on the individual needs. Everybody has the different needs as per their conditions, right? So we can monitor all these things closely.
That's wonderful. Thank you so much for such a comprehensive response. And following upon the same question, how often do you recommend these dialysis patients see a dietitian? How, do you recommend seeing every time they visit the nephrologist, every dialysis visit, or like how often do you personally think that patients on dialysis should see a dietitian for their nutrition needs?
In our setup, we are taking a rounds on daily basis who are coming in the dialysis unit. So we are meeting all the patients, and once in a month we are doing the reassessments. We are doing the hand grafts and calf muscles we are checking. So accordingly, we are giving the counseling every month. In between, they have a queries, they can check with us. So every month we are doing the reassessments of the patients.
Okay, so once a month is what you recommend at least
Yes.
for them to see. And if they have any complications or any questions in between,
Yes.
they should be seeing a dietitian as well.
Yes.
That's the standard. So all
Yes.
those young dietitians and nutrition students who are here with us today, Dr. Kanika says that, the dialysis patients pre and post, they need to be seeing dietitians at least once in a month. That's something that, we can stress in our practice. And educate people as you see them, so that it is very important for them to know that, yes, it is important for me to see a nephrologist, but it is equally important for me to see a dietitian too, because a proper nutrition can help the disease manage better and the quality of life is better. So that's something that I would like to stress. Thank you so much, Dr. Kanika. And last but not the least, I have one question here for you. Is what are some of the latest technologies in dialysis treatment that you have come across? And how do you think that they impact patient outcomes? Did you come across anything that you really think is a cutting edge and that we should start implementing? It could be a assessment tool, or it could be a supplement, or it could be a test that you have come across that you think would be something that benefits these patients pre and post dialysis.
See, if we talk about the technologies, we are using all the machines we have all for the dialysis patients. That is looking after by the doctors also. So in technology, doctors are looking for that. In our setup, we are doing the assessments, different kinds of assessment tools we are using for that. Like SGA, Kidoki SGA we are using.
Okay.
And we have a mini nutrition assessments in which we can see the functional capacity, functional test, and their muscle loss we can see. And we are doing the CLIM criteria we are doing for them. In that we see the calf muscles. So we can see the sarcopenia in the dialysis patients, right? And we see how they are at the risk of the malnutrition, right? So we are using all the tools for checking the malnutrition and sarcopenia in dialysis patients.
Yes.
Yeah.
That's wonderful. Okay. Any supplements that you personally recommend? It could be anything, right from energy source to a protein source to a fiber source. Are there any of your any supplements that you think have been more effective than the other? It doesn't have to be a name, but is it a protein supplement that you see is most effective, or is it a fiber supplement that you see is most effective? just from your practice, out of curiosity?
See, some patients have some problems. If they have problems like constipations, or they are not able to achieve their targets in terms of proteins, then obviously we advise for the ONS, like oral supplements we give, high protein supplements.
Right.
Okay. And the most important is during the dialysis, it can lead to loss of essential vitamins and minerals. So making supplementations important for their overall health. So like water soluble vitamins such as B complex vitamins and vitamin C, often depleted during the dialysis. So supplementation is recommended to prevent all these deficiencies, right? So sometimes the iron supplementations are also commonly needed to manage their anemia. So most of the patients have their hemoglobin low, and then we supplement the iron also to their diets, right? So as then vitamin D, which plays a crucial role in calcium absorption and bone health. So since dialysis patients frequently experience vitamin D deficiency, so supplementation is often required.
Right.
And omega-3 fatty acids, which is beneficial for reducing inflammation and protecting cardiovascular health. So in some cases, like we recommend all these things. Right. In some cases, if you see the erythropoiesis stimulation agents may be prescribed to manage the anemia. Obviously, it is prescribed by the doctor only,
Yes.
but we see in their prescription, right? And if we talk about another things like phosphate binders, which helps prevent the high phosphorus levels, which can lead to bone disease or cardiovascular complications. So it is important for the patients to work with the dietitians and the nephrologists to
Yes.
determine the right supplementation plan to based on their specific needs, right?
Yes.
So we
Yes.
have to see all the vitamins and minerals should see by the dietitian.
Yes, yes. Thank you so much for stressing on that, Dr. Kanika. I think it's very important that we work in conjunction with the nephrologist and they work in conjunction with us while deciding these nutrition needs, because it has such a immediate impact on the nutritional status of these renal patients. So yeah, I cannot stress enough on how much important it is for us to just work as a synergy, as a team with nephrologists, and make sure that we put across our point and make sure that we put it in a way that they understand what we are trying to say. And then most times I feel like they are becoming more and more receptive to the information that the dietitians are providing. And it's amazing to see what wonders we can create when we have teamwork trying to help these patients for whom nutrition plays such a critical role. Thank you so much for taking all those questions very, very patiently, Dr. Kanika. I know you are in a rush, but if you, we are going to move on with the next speaker, but we would love to have you back.
I am here. If I will go, I will tell you. No problem.
Yes, thank you so much. That makes me happy now.
Thank
So,
you.
all right. Thank you again, Dr. Kanika. And now we are moving on to our next speaker, Dr. Vijayashree. Thank you so much for patiently waiting for your turn, Dr. Vijayashree. And we are going to get started. Like I said, Dr. Vijayashree is from Chennai, and we are going to discuss some questions on kidney stones and few other general questions as well. So the first question that I have for you is, Dr. Vijayashree, what are the different types of kidney stones and how does diet influence their formation? If you could just stress a little bit for easy understanding, where, what role does nutrition play in kidney stones? That's something we don't stress too much how important it is nutrition in this case. So I would like to shed some light on that, please.
Thank you, Dipti. Thank you for this opportunity to share my knowledge in this. Senior people are there, so with them, I'm happy to be along with them. And coming to your question, I'll start with the least common, stones, which is called cystine stones. So it's basically a genetic disorder called cystinuria is the major cause of this kidney stone. And the next is the struite stones. People who are having, recurrent urinary tract infection can suffer with the kidney stones. And that's why, when you have people always say that try to prevent UTI, or if you have a UTI, make sure that you cure it. So it's more of infection caused by infection. So coming to the most popular kidney stones, we all know the calcium oxalate,
Yes.
followed by the uric acid stone. Both these common kidney stones have a very close connection with the dietary intake, and even say dietary habits also.
Yeah.
So coming to the calcium oxalate, it's the most common, stones we see with our colleagues, friends, family, and also in the hospital patients. So when the bones are not using the calcium in the body, so it is excreted through urine, and too much of calcium concentration in the urine causes binding of oxalate in the kidneys. So that forms as a stone. So that is what happens in the calcium oxalate. When it comes to uric acid stone, the increased uric acid secretion, and that is excreted through urine again, is the major cause. You all know that uric acid is the byproduct or even end product, whatever it is, of protein called purine. So, so we have to understand that kidneys are the one which excreting all the metabolic waste, the medications which we, medication waste, and everything, excess water, excess, electrolytes, everything is excreted through urine. So that maintaining that water and electrolyte balance and the concentration of each and every component is very important. So when you start consuming more and more of this purine, which is commonly present in animal protein, especially the organ meat and the red meats. So the production of uric acid is increasing, and the uric acid load, the acid load of the kidneys are increased by the excess amount of uric acid. So this excess acid load in the kidneys facilitate the formation of kidney. So that is why it is very important to make sure that you have a proper diet and water intake. So that can make sure that at least we can prevent forming a kidney stones.
That's wonderful. Thank you so much for enlightening us on this basic, information, because that's something that we always, forget to focus on, I guess. That's the right word. Okay, so my next question to you, Ms. Dr. Vijayashree, how does fluid and sodium intake affect the risk of kidney stones? And what are the best hydration practices that you recommend from your practice?
Yeah, see, we all know, everyone, even the people who suffer with the kidney stones or any, for better kidney health,
Right.
hydration is very, very key. So as I said earlier, the electrolyte and water balance to be maintained. And what is happening, now is like people are, the moment I say fluid, everyone thinks that it is water.
That's right.
Yeah, everyone thinks it's
Common
water.
misconception, I guess.
Yes. So people drink, sometimes even over drink water also.
Yeah,
So,
yeah.
like how you have to balance your food, your diet, you also have to balance your water intake also, which is very important.
That's right.
And you have to fix that. If I am having 1,000 ml of liquid through the diet, so rest of my 1,000 or 1,000 ml of fluid from the water. So that is very important. Instead of considering only water as fluid and drinking plenty of water. And also, if you see, people say that I drink 1 liter of water in the morning, I drink 2 liters of water in the morning. So that is not really going to help you. So instead, you have to hydrate yourself throughout the day. So that is very, very important. When you drink, too much of water, what happens is there is loss of some electrolytes. When you drink less of water, again, the concentration of all this metabolic byproducts increases in the urine. So that not only causing kidney stone, also causes kidney disease also. So we have to understand the importance of hydration in a daily life. I see people who are working carry a water bottle, 1 liter of water bottle, but most of them till evening you can see the half of water will be there in this
Still in the
water bottle.
bottle.
Nowadays all fancy water bottle and all is coming, right?
I
So
know.
even though we know the importance of drinking water and hydrate yourself, we still don't follow that. So it's very important. You have to drink water, balance. The requirement is, if you want a prevention, just follow the basic 2 liters. If your body surface is little more than that, 2 to 3 liters. If you have suffered with stones and treated stones, probably you can increase another 500 to 1000 ml of water. So that is what you have to do. Throughout the day, you have to hydrate, and especially those eating windows, you have to hydrate yourself.
Yeah.
And coming to the salt, it's very, very important. There are people who ask, why, how come salt increases the chance of kidney stones? So high sodium intake causes an increased loss of calcium in the urine. So we have to understand that both calcium and sodium share same transport in the kidney. So if you eat too much of salt, that is sodium, it will increase the calcium leakage in the urine. So not only stones, it also increases chances of kidney diseases. And see, generally the calcium and oxalate binds in the stomach and intestine. So if that process is missing, it is not happening, then that happens in the kidney. So where the formation of kidney stone happens. So it's very important. You have to limit your salt intake. The salt consumption in the in the latest period is very high because of all the junk foods and preserved, processed food, packed food consumption is very, very high. So that is why not only in kidney health, heart health, everywhere we are struggling. So the major cause of kidney disease also is hypertension. That's one of the main causes of kidney disease. So hypertension, how even younger people are coming up with a very high blood pressure. It's because of the salt intake only. So we have to stress on this salt intake together with fluid intake to prevent kidney stones and also prevent kidney disease also.
Yeah, yeah. Thank you so much. I think that is enough stressed on the importance of, fluid and how you need to use your common sense and drink throughout the day. And it's not like, okay, I'm drinking 2 liters in the morning and then I'm done throughout the day. It doesn't work like that. You just have to use your common sense, keep sipping on the fluid throughout the day. So you're actually hydrating your body. You're not like, it is not a mission or a goal to just fill it up to 2 liters and you're done in the morning and it's done. It doesn't work that way. So yeah, that's extremely important. Thank you so much for stressing on that, because we tend to do that my requirement is this much, I'm getting it. So like, where am I going wrong? But that's not how it works. You need to keep sipping throughout the day. And also the importance of sodium, how you are seeing so many young people coming up to us with all these complications. And yes, it has to do extremely lot with the kind of processed and junk food that we are consuming these days. Just to be aware of how much sodium goes into these foods is extremely important. And I think that warrants a session all by itself, how to read the label, what are the foods that are high in sodium and all. We will maybe plan a separate panel discussion on that. But thank you so much for stressing on that important point, Dr. Vijayashree. So moving on to our next question here. What nutritional strategies can help manage kidney stones?
Like any other problem, there is do's and don'ts in this maintaining or preventing, or as well as if you have kidney disease, there is every chance that reoccur. So, so people suffer with the recurrent kidney stones more often, especially the younger generation. So, I'll tell the do's first. As we already discussed, hydration. Then they were Samrudh ma'am and Kanika ma'am also stress on fiber, especially from the plant source, fruits and vegetables. Why it is very useful is it reduces the metabolic acidosis and the acid load in the kidneys are less. I already told that the more acid in the kidney, there is every chance of kidney formation. So eating regular fruits and vegetable, like as our ICMR NIN recommends, in a 5 portion of fruits and vegetable, thus if you follow that, you can very well prevent and also manage the kidney stones. Coming to the don'ts, calcium, actually, there are again, a lot of miscommunication. I see people completely avoiding calcium rich food, thinking that it is causing, kidney stone. So we also have to remember that by reducing, you should not go into calcium deficiency. So what is a normal requirement? 1,000 to 1,200 milligrams per day. There's nothing wrong in taking that. So the key is consuming calcium and oxalate together. So what is happening is when you take both together, it is getting binded in the intestine or stomach, wherever it is, in the GI tract itself. So it will be, excess will be excreted in the urine. So there is less chances of forming kidney stone in the kidneys. So that is one thing. And if you are, suffering with kidney stone, so try to do this. Avoid oxalate-rich food as much as possible. Like oxalate-rich food are like caffeine-based, cocoa-based foods, coffee, spinach. Some of the red meats also has this oxalate. We should be little restrict those items. But definitely, avoiding calcium or restricting too much of calcium is not really going to help you. But if you're taking calcium supplement with the, presence of kidney stones, it may, may not help you. So you should be a little careful when you're taking calcium supplement. And coming to the uric acid, as I already told, restricting the non-vegetarian protein really helps to reduce the production of uric acid because the purine is mostly present in these, uric acid. Yeah, also some of the gluten, food items also is increasing the uric acid. So they also have a little bit of purine in it. So we should be avoiding if you are having a uric acid stone. It is also important that what type of stone accordingly you advise. So there are common advices like hydration, salt restriction. But there are specific restriction and diet patterns for calcium oxalate stone people and uric acid stone people. So that we have to assess before giving a what is happening is most of this kidney stone cases, they just Google it and see what are the foods to be avoided. Yeah. So they just type kidney stone. So most of them don't even know what type of stone they are having.
Exactly.
So, yeah, that is another important thing that we have to do it. Then caffeine, as I already said, should be avoided, and salt, which I already told how it is causing. So if we do this basic thing with a balanced diet, so we can very well, prevent and also treat kidney stones. High fiber, of course.
Yeah, that's another important, nutrient that need to be stressed is the fiber. Thank you so much for that elaborate answer, Dr. Vijayashree. I think it is very important to have that education in place when it comes to kidney stones. It is not kidney stones. There's like different kinds of kidney stones, and then we have do's and don'ts separate for each of them when it comes to diet. So having that awareness among the general population is extremely important. Like you said, they just Google and the information that's out there in the internet is too much excess information that kind of confuses them and creates even bigger problem when it comes to kidney stones, especially. When dealing with do's and don'ts, avoiding certain type of foods completely or overdoing on some foods, or like, the hydration part is completely neglected, or like you said, the calcium supplements, and so many things that, you know, that are that have to be considered when kidney stones are a problem. And I think the next question that we have here is on the same lines, and it's about supplements. So, are there any specific supplements that aid in preventing or treating kidney stones, and what are the treatment options? I know you stressed a little bit on calcium supplements, but did you come across any specific supplements that you recommend for treating the kidney stones? If yes, what are those, and what are the treatment options available for that?
As a nutritionist, I only think of nutrition supplement.
Yes.
So, see, to be honest, there is no specific, supplement which can prevent or, treat kidney disease as far as nutrition is concerned. But there are few researchers showing that magnesium, good magnesium intake, vitamins like B12, B6 and thiamine are important in prevention of kidney stones. So make sure that your patients are eating such either through food, or if you're not able to get it through food, maybe a supplementation is required. But some of the physicians are, suggesting a few supplement, which is not, I don't know whether we can call it a supplement or not, like potassium citrate,
Windows?
yes, thiazide and all those things, which helps to, reduce the formation of kidney stones.
Yeah.
So this is what about, I already told you, is calcium supplement. If you're having a calcium oxalate stone, and if you're taking calcium, supplement, we should be very careful. You have to consult your doctor as well as the dietitian, so that they will calculate your intake, and whether you need a supplement or not, they will be inform you. Same thing with any supplement,
Right.
See, what is happening nowadays is everyone, see the B12 and B6, even vitamin D deficiency is very common. So people are, without consultation itself, they are just starting on supplementation.
That's right.
So there are people, even we have had people who are admitted with toxicity, supplements of toxicity. So that we should be very careful in taking supplement and also prescribing supplement. So without proper assessment of intake, we should not, prescribe any supplement. So there are so many treatment. The best way is, naturally by increasing fluid and fiber, fruits and vegetable intake. But when the symptoms are severe, we cannot still, treat with all these natural remedies. So we have to consult a doctor, get a proper screening and assessment done, and accordingly, there are medications there for the pain. There are medication, to break the stone. We can go for it, or there are, procedures, like the urethroskop and other thing, alpha blockers are there. So these treatments, which is more of physician's choice based on your condition, they will help you. But as far as you don't have symptoms and you, pain and other thing, you are doing good, try to, solve it with a natural way. So that is what we advise as a nutritionist. We believe in natural way
Yeah,
of
yeah,
doing
diet
things.
as a medicine rather than,
Yes.
going the medicine route, to make sure that you follow the guidelines for each of those stones separately and all of that. That's wonderful. I mean, I think it's enough stressed that, diet plays a key role when it comes to kidney stones. So I actually would like to see if any of our other panelists have anything to add, especially the role of nutrition in kidney stones. That is, I think, is the least discussed topic when it comes to kidney diseases. It's always like CKD, and like we are talking about end stage, and we're talking about dialysis, but we are not stressing enough on the importance of nutrition in the kidney stones. So I would like to open it up to our other panelists, Dr. Zamrut, Dr. Itzita, and Dr. Kanika, to see if any of you would like to shed light on how important it is to, have these nutritional interventions in case of kidney stones.
I think Vijayashree has summed it up beautifully, and she's not left any corner that she has not touched. So it's done wonderfully. But only as she rightly put, that before you prescribe somebody a diet when they are coming with kidney stone, you need to know the composition of the stone. If you do not know the composition of the stone, and if I have to advise a diet, it's going to be that I will be talking only of nose restrictions, which may not be practical for somebody. But as she rightly put, protein moderate restriction, salt moderate restriction, actual adequate hydration is very important in this population, whichever type of stone they may be having. But another thing that you have to understand is these people have low levels of 24 hours when you do their test of citrate. So giving them supplementation with citrate, and the best source from diet is your unsweetened orange juice. If you give that, it prevents the formation of the stone. So it is known as inhibitor of stone formation. So if you add this to your patient's diet, it really helps them in preventing further formation of stones. So I think that is one thing that I would like to add from my side.
Yeah, that's great point. I mean, it is such a simple solution to such a complex issue, Dr. Zamra. That's wonderful that we can. I think that's very simple way to add as well. It's not like something that you can't find anywhere. Oranges are pretty common fruit. And then, we can easily get hold of the juice, and it's not expensive, and it's easily available, digestible. So it's a wonderful choice to have. Anything else that any of you would like to add, Dr. Kanika or Dr. Ipsita, on how important the nutrition is when it comes to
Ma'am Zamrud, ma'am, this is for you. See, we also have people who are coming for kidney stone treatment, but half of the time we don't find what type of kidney stone is.
I
That,
agree with you. I totally agree with you. So it becomes
yeah,
the only thing is then you keep drinking, and the most common form is calcium oxalate. So those are
yeah,
some restrictions. And anyways, even if it is a uric acid stone, if you see in general, you're prescribing a moderate protein restriction. So
yes.
anyways, for uric acid, again, that your diet would work. You're absolutely right. It's very difficult. Very few people will come with actually a report which says what is the composition of the stone. Very, very, very important for us.
And also, I think it is very important to have that nexus again with, going back to that nephrologist, because they are the ones who prescribe these tests, and they are the ones who have access to all this. So you cannot expect the patient who is not educated sometimes to have information on the kind of stones, and, how big is the stone, how many They're not going to have any of that information. All they know is they have a kidney stone. I mean, it's I think too much to expect from them to even come to a dietitian when they're coming and sitting in front of us to ask them that, okay, now tell me what kind of stone do you have? It'll be too much to expect. So yeah, to just assume that it is one of the most common, like Dr. Zamrit said, it is oxalate, and then have these strategies in place. But then again, having that nexus with nephrologists and making sure that we are teaming up with them, and we are working in conjunction with them to get all this basic information that is needed for us to make our treatment option much more effective, when it comes comes to be the kidney stones or any other renal condition. I strongly agree with that. So moving on to our next question for Dr. Vijayashree. How does AI tools help assist in maintaining kidney health? This is not kidney stones in particular, but in general. What are your opinions? I know you have been working a lot on research in your organization, and I would like to hear from you. What does AI tools that you have come across that you think are more beneficial for kidney health based on your experience?
Yeah, see the AI tools, this is the entire medical fraternities are looking forward as the using of AI tool in treatment of any health problem. So what is exactly happening is there are some tools, AI tools, in a particular patient, it gathers all the information, datas, whatever they have, and it gathers and it helps in assessment and early diagnosis. That's the most key when it comes to India, because most of the diseases are diagnosed early in India, whether it is a diabetes or a kidney disease. So that's a major problem we are facing it. So that is the best thing happens with the help of AI. And also, the risk, predicting the risk who is going to have, a kidney disease. And also, what type of treatment can be given to these people based on the past histories, like even if it is 10 years or 20 years of history. So that is going to help in that way. And the how the resources can be allocated in the hospital itself. But the problem is, for all this, you need a EMR.
Right.
So you need a EMR where all information of the patient is there in the computer, so that the AI can be very well be used from the assessment to diagnosing to treating the patient.
Yeah, that is extremely important. I think we have to be mindful of that fact that we need, yes, AI, yes, it is coming in all the fields that we are looking at, but then having access to that basic health information is what is more important when it comes to treating these patients and knowing their medical conditions better. We need to have access to those EMR sheets and medical records online to make our treatment part more effective and efficient. Yeah. Thank you so much, Dr. Vijayashree. I think that has been such an elaborate and valuable input on how important nutrition is when it comes to kidney stones. Like I said, it is one of the least discussed subjects when it comes to renal nutrition. And we have a lot of awareness to create in the people on the kind of stones, the kind of foods and restrictions, do's and don'ts and all of that. So, and that's usually a very beginner level when it comes to the complications of renal nutrition. So thank you so much for that. We'll come back to you for some exciting questions. But I would like to now move on to our next speaker, Dr. Ipsita, has been very, very patiently waiting for all the glitches to go away, all the speakers to finish up. Thank you so much for your patience and waiting for us. We really appreciate you working with us through all these challenges, Dr. Ipsita. We'll quickly move on to your questions. Dr. Ipsita will be discussing with us on the role of nutrition in transplant. This is another area which, is extremely important when it comes to nutrition management. So how important, my first question to you is, how important is pre-transplant nutrition in improving transplant outcomes? Because we usually have some time there. It is not like, you know that you have a transplant tomorrow and you're just, rushing them today. You do give patients do have some time. So what are some of the things that you recommend working on pre-transplant for better transplant outcomes? Dr. Ipsita, what do you?
basically pre-transplant patients, either they have gone through till stage 5, either they are undergoing HDR hemodialysis or peritoneal dialysis, or they're going for preemptive transplant. That means they didn't have undergo any dialysis and directly from CKD stage to they're going for transplantation. For these cases, patient was on totally low protein diet and they're only jumping onto the transplant. Otherwise, if it's a HD or PD patient, they are given little high protein diet and they are going in.
I'm sorry, Dr. Ipsit, I think if you can just move a little closer to your mic, because it's kind of
Is it okay now? Am I audible?
perfect, perfect. Thank you. Yeah.
So basically, preemptive transplant can also be there where patient has not undergone any dialysis and directly from CKD, and patient had undergone, I mean, directly to the dialysis part, I mean, transplant part, or else patient had undergone HD or PD, then only patient goes in for the transplant. But the major concern is we need to do the nutritional screening before transplant, which is a very crucial thing for assessing the patient nutritional status, identifying the deficiency and optimizing overall health. So maintaining nutritional status is vital because physical and nutritional health might deteriorate during this period because there also mental stress comes into picture. So we need to maintain everything. Counseling matters a lot. Preventing PEW, renal osteodystrophy, maintenance of serum protein, glycemic control, all comes hand in hand. All are very, very important. And the main goals are, I should say, maintenance and improvement of the nutritional status and repletion of deficits, if at all it's there. Reduce catabolic consequences of organ failure, minimize the risk of pre and post-transplant infections because more the chances of infection, there's more chances of graft kidney transplant kidney rejections, and optimize transplant organ function and decrease chances of reduction of all this. Because the moment you are transplanted, one particular person is getting transplanted, our utmost criteria is to prevent that graft kidney functioning well. So at the same time, you need to focus on the comorbidity, you need to focus on the body weight, you need to have your protein energy wasting under control. So calorie intake, protein intake, those have to be looked into, and whether your body, mind is absolutely fit to undergo this transplantation, because a foreign body is being fixed to your body.
That's right.
So you have to think about that, and then only you can come to a conclusion that this particular person is fit to be transplanted.
Yeah. That is so important to stress on not just the nutritional, but the mental health of the patient, to have the fact that, we are having something foreign in your body and there need to be adjustments made. It is not, just like some kind of machine, but it is a foreign body that you are going to fix into your body and you need to make changes accordingly to
That has to be
adjust to that.
adjusted in your body.
Yes, yes, until it gets adjusted in your body, and then there are so many changes that happen, and it is such a crucial and sensitive stage. So mentally being prepared is extremely important as much as it is nutritionally and physically important. Thank you so much for stressing on that point. So what kind of dietary precautions should a patient follow post-transplant to ensure kidney health, Dr. Absa?
Immediately after transplant, like 4 to 6 weeks, 1 month to 1.5 months of post surgery, you can say the calorie should be like that. It's guidelines I'm talking about.
Yes.
30 to 35 kilocalorie. Protein should be 1.3 to 2 gram per kg body weight, and fat should be around 30 to 35%. And fluid, if there is no rejection, there has to be ample fluid which needs to be taken, and zinc, which may be needed if to suppress the, I mean, not suppress, I should say the support the wound management, wound health, because that's a surgery. So body has to, adjust with the foreign body, what I have already said. So zinc may be supplemented, and primary objectives are to be, despite protein catabolism, visceral protein reserves have to be maintained, enhance wound healing, that we need to see, prevention of infection associated immunosuppression and surgery, because after post-transplant, immunosuppressants are given. So once those are given, patients usually tend to eat more. They feel more like hungry, they tend to put on weight, they tend to develop diabetes, which is called NODAT. So these all we need to focus, and all dietary precautions, and of course cleanliness and hygiene. These are the two very important things which needs to be focused while we consider a post-transplant patient nutrition is concerned.
Yeah. Thank you so much. And I'm actually going to go to a question that we were discussing in the beginning of our discussion with Dr. Zamrud about the plant-based nutrition. So, how can plant-based diets be safely followed after a kidney transplant? Have you come across any research that shows that plant-based diets have been effective after transplant? And if so, is in early detection and in organization of the whole kidney health gamble. How important are these plant-based diet, and how can you safely follow them after the transplant?
Of course, I support that, because plant-based diets are beneficial. Managing the body weight, blood pressure, lipid profile, all are very, very important while managing your kidney post-transplant, the graft kidney.
Right, that's right.
And plant-based diet tend to be lower in sodium, so which is also very, very important for a post-transplant patient. Those are high in fiber, which Zamrud has elaborated in her first comments.
Yes.
So fiber helps in diabetic management as well as weight management, which is also very important for post-transplant patient. Avoid high, and we need to avoid high in sodium, high in potassium, high in fat. Potassium, if at all, if it's deranged, if that electrolyte derangement is there, otherwise normal potassium can be taken. Increasing plant protein in diet, it is shown that 20 grams increase can decrease 60% of failure.
Wow.
So that's a major thing. So if we focus on the plant-based diet and whole grains and nuts and plant-based milk, tofu, tempeh, soya, these are the items which can be included in the diet, so that you can maintain your protein intake. At the same time, your protein sources are coming from the plant-based origin. So that way you can keep your diet on a plant-based way. You can manage your graft kidneys.
Yeah. So you definitely think that, having a plant-based diet post-transplant is useful, and it has been seen to be more effective in terms of managing nutrition post-transplant. That is good to hear. The quality of protein in terms of fiber, in terms of sodium, in so many other ways. Yes, of course, the potassium always remains a challenge, but then I think there are ways to tackle that with the medications and with the other, processes that we use to remove the potassium from the foods. So that's wonderful. Thank you so much for that. And what are there any specific foods or nutrients that aid in the recovery and longevity of the transplanted kidney? Do you recommend to add, or do's or don'ts, basically, that some of the foods that you would like to add to their diet, or some of the foods that you don't want them to have?
Basically, the key is a balanced diet. You need to focus on a balanced diet. Eating meals on time, taking medications on time, do not skip meals. You cannot be erratic in your lifestyle. So lifestyle has to be maintained in a very proper way. Diets rich in fiber, which I've already said, through vegetables and fruits, choosing lean protein, non-fat dairy, healthy fat should be the choice, and sodium, potassium, phosphate, and unnecessary intake of wrong food items. Unnecessary, and I should say all processed food items should be avoided. It has to be home cooked, well balanced meal, which has to be taken for healthy maintenance of a post transplant. There is no particular food item that you eat this food and your kidney will be absolutely perfect. It has to be a balanced meal, and it has to be all like macronutrients has to be there in a proper way. If patient is, we need to focus on few things, like if patient is obese, then we need to focus on that obesity part. If patient is an old diabetic, then we have to be focusing on the diabetes part. If in patient is on a newly onset diabetes, which is usually happening after transplant, no diet, which is in short, it's called. So there we need to focus on that also. So these are the basic few things when we need to focus while planning the diet, while counseling the patient. And in renal, as a renal dietitian, I could say, whenever a renal patient, maybe from stage 1, stage 2, the HD, PD, and even post-transplant, we should be always in constantly touch with the patient so that they, whenever they're in trouble, whenever they have any altered blood parameters, they can get in touch with us and we can guide them properly so that they can, maybe during dialysis, non-dialyzed, even for post-transplant. That is my suggestion. So we should be working closely with them.
Yes, yes. So there is no miracle food. It all depends on, like, general basic balanced nutrition, and definitely cutting down on the processed foods because of the risks it poses, and then addressing the major concerns like obesity and diabetes, and not trying to look for one food that can solve all the problems, or one food to blame on that is creating all
Because of that, it has happened.
Yeah, exactly. So we don't have anything like that. So that's something that we need to keep stressing when we are educating these, patients. Dr. Zamrud, would you like to add anything to the discussion?
No, I'm just, she's absolutely right. Transplant, you cannot think that now they have got a new kidney, a new life, and you cannot just leave them there. She's absolutely right. You have to keep handholding them for a long time.
Yes.
And as the transplant gets older, probably you need to train them how they have to maintain their weight, how they have to eat little lesser protein than a normal person, because they are not a kidney patient now, but they do need to preserve the kidney that they have.
Because our single kidney is working. That is the major thing.
And that is not their native kidney. It is
Somebody else
foreign kidney.
It's a transplanted one.
So your body may be trying to not accept it easily, and at the same time, the function is going to be limited. You're just going to be with the function. So you need to restrict the proteins as the transplant gets old. Initially, you have to give a high protein, but as transplant gets old, as if
You have to reduce it to that.
But even at that stage, in that group of people, you need to concentrate and give them lesser calories, but give them fiber. Now, at this stage, again, fiber is very important, because if fiber is there in the diet, probably their hunger pangs can be controlled better. If it is not there, this is deficit diets of fiber, then probably the calorie restriction, they do feel hungry. So fiber is something that you have to use in this population again, like not only in all, like how she said, all stages of chronic kidney disease to reaching the end and going for a replacement therapy, you need to work on all the nutrients. You cannot say that this is not important and only this is important.
Yeah, that is so important to educate these patients on. Like, it's not like you have a new kidney and then everything is going to just set right the day after as soon as you have this. There is some more work.
Actually, they have a tendency to eat on gulp on something, because after so prolonged years, they are free, they can have everything, they do not have any restrictions, so they just tend to have everything. So there they have a tendency to put on weight. They have to be counseled that your body weight is adversely working on your graft kidney. So that has to be like counseled, that you have to maintain your body weight properly.
So I think you need to counsel them pre-transplant. And one more important fact that they need to be told is that whatever was your weight prior to your disease, okay, your body is going to try to get you back once the new kidney comes in, your functioning becomes normal. And probably that's what we also see in our transplant patients. Whatever weight they gain is in the first year post-transplant. After that, weight gain is not much. So that itself indicates, so that's the reason counseling these people is very important pre-transplant rather than working later on. That's very important.
Yeah, because that's when you can get this message across, not after they have the transplant and they are in this fairy tale mindset where they think, okay, now I have a new kidney, like
absolutely, I can go everywhere and
I can
do whatever I can,
eat whatever. Yes, but not yet. We have some more.
You have to be more cautious so that you can maintain and you can keep that correct
Exactly.
functioning well.
Yes, that is where the pre-transplant nutrition plays an important role. And again, I think it's enough stress that the role of nutritionist in this whole process, even in the transplant, it's not like, they can directly go see the nephrologist and then get the transplant and then they're done. I
It's a
think
long
our
process.
role is extremely important as nutritionists to work with these patients before transplant and make sure that they are in the right frame of mind to accept that information and make sure that being cautious, they're monitoring what they have to monitor, and they are only making sure that they are following the restrictions that are given to them, but not like go on the other side of the spectrum and then end up in complications, because like you said, it's a foreign body in the body and they need to take care of that. That is wonderful. Okay, so we are moving on to our next question, Dr. Ipsita. So what is the role, what role does diet play in preventing the kidney function decline after, transplant? Do you have any suggestions that you would like to extremely, I know we talked about being, balanced diet and all of that, but have you come across any of the common things that you see that these people doing that they should absolutely not be doing in your practice?
Basically, what I said, you have to keep a good watch on your comorbidity if that exists prior to your transplant, like hypertension, diabetes, if any cardiac issues are there. So renal impairment was there post transplant. You have done your transplant, but that doesn't mean that your comorbidities have gone. So you have to maintain that. You have to focus on your body weight, which if increases because of immunosuppressant, patient have a tendency to eat more, and they tend to, as Zamrud was also saying, that there is a tendency of putting on weight within almost post 1 year transplant phase.
Yes.
So body weight has to be maintained. Limiting processed foods and sugar. Weight management is mandatory. Once you are out of this post-surgical restrictions, exercise is mandatory so that you can maintain a body weight. Blood pressure needs to be monitored. Cholesterol needs to be in focus. And all the blood workups which are given by the doctors within a regular interval of time, like sodium, potassium, phosphorus, and all those, whichever is being given by the prescribed by the doctor, we should not skip anything so that we can keep a close eye on the status of the kidney, graft kidney, and healthy diet ultimately reduce the risk. We have to have good protein, good energy, and restricting all other or nutrients which we are not supposed to have in our diet. So these are the basic ways which we can prevent, and of course away from low heavy gathering, try to avoid infections, source of infections. Cleanliness, hygiene matters a lot. Don't go and eat anything, buy anything and just gulp it down. These all are basic things. Even if you tend to eat out, you discuss with the chef out in the hotel after a long span, I should say, not immediately post transplant. So you give your restriction. Your diet has to be little low sodium. You restrict these, restrict that. Then only chef can prepare the meal according to your choice. So that way you can become, I mean, like normally you can lead your normal life, at the same time restricting few things in your life so that you can maintain your graft kidney.
That's wonderful. And just in, further elaborating on that, what are your thoughts about supplements, the role of protein supplements or in general any other supplements after transplant? Is that something that you recommend? And again, there are so many factors in that, their nutritional status, their requirement, and so many other things. But what are some of the protein supplements, if at all, that you recommend, that you tend to recommend, and how often do you recommend, and what is your rationale to recommend those?
If I recommend at all, it entirely depends on the patient's intake. If prior to the operation, patient is already malnourished, patient was having PEW, then I can think over giving some supplement. Otherwise, patient was having normally, then there is no point in giving extra supplement, extra protein calorie intake. to that particular person. But if patient is not eating weight, patient's intake, whichever protein and calorie needs to be given. So there we need to focus on that particular patients, depending on all the comorbidities, all the clinical parameters. We need to go through everything and we need to choose the supplement, because here in this platform, I'm not supposed to share the name of the supplements. I'm just
we are not looking
why,
at
why we need to do this. So there we can, and there are different researches which say that at least for 3 months trial, it should be given for a healthy outcome for that post-transplant patient. If pre-transplant patient was not healthy, was malnourished, patient, even post-transplant patient is not eating well, patient's calorie protein needs to be increased, there I recommend supplement. Or else if patient is eating well, patient is cooperating well, I do not recommend supplement. It's not necessary that every person has to be given supplement. According to me, it's my opinion. I do not give in my practice.
Yeah, I totally agree with you. It is not, mandatory.
It's a mandate. It's not that.
Yeah, it is definitely not. And as nutritionists, our first role is to look into the diet part and how can you make these changes. And only when there is a need and when there is, like I said, rational, that is when we are going to look into the option of, supplements. And it is not like, the assumption of like writing fancy supplements and having a fancy diet plan is something that they expect from dietitians. So it's not that, that you are just writing it for the sake of writing. There is always a rationale if you are having a supplement out there. And when there is no need, we don't have to suggest unnecessary supplements, and it can be any supplement for that matter, the protein or the fiber or any other multivitamin or any other supplement. So thank you for that wonderful response, Dr. Ipsita. And I have one last question here for you before we move on to some of the questions that we got from the participants, which we will have as a group discuss. What are the most critical dietary changes for the patients after a transplant that you suggest? Some of the critical dietary changes, like lifestyle changes that we call, like, like say, for example, having a soft diet or having some kind of always don't have raw foods or these kind of things. What are some of the critical things? Like if you have to pick top 3 for a transplant patient, what are your top 3 recommendations?
First and foremost, I would suggest cleanliness and hygiene matters a lot for a post-transplant patient. That has to be maintained, because when patient is on immunosuppressant, they are like little vulnerable. They are like, their body behaves like a child. So they are prone to infection. They are prone to catch up some diseases. So it is better. So that cleanliness and hygiene needs to be maintained.
Excellent.
All blood workups which needs to be done, which are usually done after regular intervals. So we need to focus on those.
Yes.
And homemade diets, no diet, eating out, at least for first few months, no eating out, no processed food, and home-based diet, healthy, balanced meal has to be there. First 4 to 6 months, you can increase on, focus on the protein, because that's a foreign body adjusted to your body. So you need to, that body has to accustom with the foreign body, and that has to get along with your body and start functioning, because body has a tendency to reject a foreign thing. That's a automatic, our internal system is planned that way. So we should work that way. Otherwise, it's a balanced, healthy, homemade meal with cleanliness, hygiene, and with sodium, potassium, salt, fluid. If diabetes is there, these are the basic few things. Weight management, which I am constantly focusing on the same issue. One should not become overweight during this phase. So these are the basic few things which need to be focused. And of course, a clinical dietitian should be regularly in contact with that person, so that for any dietary changes, any needs, any if they need to ask anything, if any changes in the blood parameters, we need to counsel them, and what necessary changes or modification, if at all, needs to be done, we can counsel them accordingly.
How often do you recommend them seeing a dietitian after transplant?
If transplant like all blood parameters are okay, then 3 months are fine. Otherwise, if there is any change in the blood parameters where dietary intervention is very much required, as and when required, there is no, I don't recommend any specific time frame that after this time only you are supposed to come and visit the dietitian. Whenever needed, you are supposed to consult the dietitian, and so that it can be catered immediately.
Yes, yes. As soon as you feel the need, you should just see and not wait for
Absolutely.
like, okay, I'm going to meet her in once in a month. I'm going to write down all my questions and all of that. So you just better get in touch with the dietitian, just like how you get in touch with the nephrologist, your doctor, as soon as there is an issue. So you have to do the same with the dietitian as well. That's wonderful. And I'm going to add one last question to you, Dr. Ipsita. I have been very curious from everything that you have been saying. Do you see the role of exercise? You've been stressing a lot on weight management and how it is so important to have this. So I've been reading about muscle mass and how important it is to be physically active, for the transplant patients or in general for kidney disease patients, to have the muscle mass. So do you recommend exercise at all for these patients? If yes, how much do you recommend and what are your thoughts?
Post-transplant patients, at least they should exercise because they need to maintain their muscle mass. Because as I have already said, pre-transplant, pre-dialysis, these different stages they have gone through. So protein energy wasting was there, muscle loss was there, muscle wasting was there. Even during dialysis, few patients are there who cannot take protein properly. So automatically dialysis, a huge loss is also there. So in those cases, post-transplant, we need to focus on the intake. And after a few months, when the surgical part is stated by the doctor and doctor gives a green signal that that particular patient can go ahead with exercise, at least 20 to 30 minutes, at least walk.
Yes.
No heavy lifting and all. I'm not saying gym and all those exercises. Simple walking should be done by a particular person who has undergone transplant.
Yeah, I mean, it's extremely important even for the in so
You
many
have to be
years.
back to your normal self.
Yes, I agree. Yeah, getting back to normal self is important and not being like in a shell where you are like, treating yourself as a bubble. And
Little bit of tweaking in your daily activities, you come back to what were you before your kidney started suffering or kidney damaged.
Yes. So the goal is to get back to the normalcy as much as possible and to do activities that have been normal. So the quality of life is better.
Absolutely.
I'm getting that right? Yeah. That's wonderful. Thank you so much for all those enlightening answers, and it has been wonderful discussion, Dr. Ipsita. So we have asked the participants, whoever has registered to our panel discussion. By the way, we had a lot of participants today, so we had to branch them out into YouTube. That was the background that we were hearing some time back. But we had a good number of participants in our panel discussion today. And they have sent us some questions beforehand that they wanted our panel members to address. So I'm going to go over some of those questions, and we can take based on whoever would like to, take the questions. You, Dr. Ipsita, or Dr. Vijayashree, you can take the questions. And Dr. Kanika? Dr. Kanika? Okay, I'm going to go ahead with both of you for now, and then if we have Dr. Kanika join us, then we will have, or Dr. Zamrud has to leave for another meeting. So we will make sure that we send questions to her so we can get her feedback as well once we are done, and then we can circulate it with the panel members and as well as the participants. So the first question that we received here is it's a basic question on malnutrition. So how do you treat malnutrition in CKD patients? How do you identify them, and how do you treat malnutrition when it comes to CKD. So what are some of the tools that you would use as a dietitian, and where do you see the intervention, the role of intervention when it comes to malnutrition in CKD patients? Any of you, maybe Dr. Ipsa, you can have a little break. Yeah, I have been picking your brain for so long. Maybe if you want to take it, Dr. Vijayashree, or any of both of you can just chime in your thoughts.
Basically, patients malnutrition during different stages of CKD, due to lack of protein intake, patient tend to lose muscle. So we need to focus on the calorie. And at the same time, as most part of the India are vegetarian, so their protein intake is on the lower side. Maybe a few parts of India are like, as I was saying, the part of India I am working, they prefer to have at least one meal, some non-veg item should be there. So, but to focus on the calorie content, the energy that has to be maintained. And before, and if patient goes in for dialysis, so there we need to increase the protein intake also. So there the patient needs to be counseled, because post-dialysis patient, when patient started with dialysis, they have a preconceived idea that I have, my kidney is not functioning. This dialysis has started, but still I would go in with the low protein diet and I'm not going to add anything in my diet. So there our role comes into play, and we need to focus on there. We need to talk to them, we need to counsel them, and we need to focus that, need to make them understand that this is the dialysis process, this is what is being losing out. Why do you need protein? If you do not take protein, what alterations in your body can happen? So these are the basic things we need to make them understand. That is the major thing we need to tell them, so that yeah, protein at the same time energy can be catered. And prior to dialysis, there was a problem like when urea creatinine is on the higher side, patient feels nauseated, don't feel like eating anything. Even sometimes they are puking up also after eating. So they have some psychological problem, they have some psychosocial problem. They have some problems in the family, like there is nobody to look after, he or she herself looks after. So these are the basic things where we have to be very, what should I say, that patient with our support is needed.
Right.
Our support is needed. It's not our means, not as a dietitian, as a whole, as a
Team.
whole patient care team has to support, because it may also happen that patient was going to the market to suffer around. But after developing this PW and all, patient cannot go out of the, out of home. So that also becomes a major concern, and psychologically they becomes very, very down.
That's right.
These are the situations where our counseling comes into play.
Yes.
We need to counsel according to the stages of the CKD.
Yeah. Thank you so much. So my next question here is on the similar lines from one of our participants that would like to know, what are the nutritional supplement for muscle wasting, drastic weight loss, or low BMI in CKD patients? What nutritional support do you recommend?
See, I cannot recommend any, any name I cannot take here. But if patient is on low protein diet, if patient is not on dialysis, lots of good companies, they have their non-dialyzed patients product that is there in the market. But you have to remember that they all are fluid restricted. So when you recommend these sort of products, you need to counsel them how to take the product, when to take the product. Even sometimes I shared with my patients, suppose in a 250 ml of water, you mix the powder, the supplement, and that's so much of scoop, keep it diluted. Whenever you are sipping through, you sip with that. When you are having medicine, you have the medicine with that. So that whenever you are sipping some amount of water, that nutrition goes in. So that way also you can manage. Right. Because as it is all the time, they are fluid restricted. So fluid supplement, you can, if a patient is on dialysis, so their electrolyte, automatically you need to focus on that while choosing the product. Low electrolyte product has to be there. And for HD or PD patients, there has to be a high protein product needs to be given.
That's wonderful. Dr. Vijayashree, would you like to add to the discussion, please?
Yeah, see, we have to understand that with the whatever research we have done, so we have to categorize the people that those who are on dialysis or on non-dialysis, those who underwent transplant. So each one requirement is different. So we have a low protein diet in the CKD.
Yeah.
And we have a little higher protein in hemodialysis and very high protein in peritoneal dialysis. So the common restrictions are the sodium, potassium, electrolytes should be monitored. And most of the renal supplements are coming up with the low electrolytes only. But we have to accept that, especially in the renal dialysis cases, their protein intake is comparatively less. So there are more percentage of people required supplementation. So we have to identify. For that, you need to do a proper assessment. So there are people who say that they eat well. So we are eating well. I had three idlis in the morning. I had rice and all those things. So when you calculate, you will find out that there are lack of protein in it. They may not be eating sufficient other nutrients. So it is very, very important to do the 24 hours recall, then find out whether this patient is required a supplement. But supplement is very helpful, especially in dialysis patient. So there's so many people depending on supplement to get their nutrition requirement. It is not only the protein, also the necessary micronutrients. When what is happening is in CKD, we restrict protein in some pre-dialysis cases.
Yes.
So on the process of reducing protein, they just reduce the calorie intake also, because the food intake itself is coming down.
That's
So
right.
what is happening? The insufficient calories and lesser protein causes malnutrition. So first step is to make sure that they eat enough calories. Second step is, based on the protein requirement, we have a high biological value protein and the other non-essential amino acid protein. So the high biological value protein is decided based on the number of essential amino acid, the digestibility, and the availability, bioavailability.
Right.
So, how to make the vegetarian protein into a better availability, high biological value protein. There are so many traditional methods like fermentation, germination, all helps to improve the quality of protein in the vegetarian sources, because we all know that vegetarian protein are has more non-essential amino acid to compared to the non-veg. And at the same time, we also found that plant-based protein are very helpful in renal patients. So how to balance this both? So we have to educate our people, especially the vegetarians, how to make vegetarian food into a better quality protein.
That's right.
By using our traditional methods.
Yeah.
So that is one thing. And supplement also in some patients, even in the pre-dialysis with the protein restriction, is really helpful, because they are unable to meet their calorie requirement and other micronutrients. So such patients need supplementation. So as I said earlier, it is all how we assess, how accurately you assess.
Right.
So that's my opinion about it.
That's wonderful. That's very comprehensive, and to stage where they are and then address the need rather than having one blanket diet or one blanket strategy for all the renal patients. I think that's wonderful. We have one of the participants who has been constantly asking the question to comment on keto analogs. Would you like to take that question, Dr. Vijayashree? I'm not very sure. What about the keto analogs? Are you
Keto
trying?
analoguses are used in
So
CKD
I
patients.
think they want discussion on keto analogs. That's what I am assuming from what they have typed there.
Yeah. So it is very useful in pre-dialysis where the protein restrictions are there. So if the patient are restricted protein, and their intake is very poor. These keto analoguses are used. It's basically an amino acid which will produce less metabolic waste. So it will not increase the creatinine and other level. So it is very useful in people who are following very low protein and low protein diet. Also those who are malnourished. So the previous question, this is also one of the answer.
Yes, that's right. Thank you so much for that, Dr. Vayashri. And I think we have reached, to the end of our panel discussion. I still have a lot of questions that I received, and I'm going to pass it on to our panel members. So, and then once we get the responses, we can share with all the participants. But one last thing that I would like to add here is, I think it's extremely important. I think after all these discussions that we had for past 2 hours nonstop with all these eminent speakers from all over the India, one thing is proven time and again, that the role of dietitian when it comes to the kidney disease is extremely crucial. Our synergy with the doctors and the care team is extremely important in maintaining the nutritional status of the patients, because it is so directly related to the condition. They are so sensitive when it comes to all these micronutrients and the minerals and the protein, fluids. There's so many components that play into this kidney disease, that it becomes extremely important for us as dietitians to look into all these and regularly monitor them and make sure that they are meeting their needs, and they are having good quality of life, which is what we all want at the end of the day, the patient having a better quality of life. So that's time and again proven, and I feel like more and more education to the young dietitians is needed to make sure that we get this point across, and it's not always one blanket way, or not just seeing the patients who are on dialysis or on transplant. Even the kidney stones, we have stressed enough that it is very important to see the role of nutrition when it comes to the kidney stones as well. But those are the kind of things that we want to educate these young nutritionists who are coming into the practice, and these nutrition students who are enrolling into the nutrition courses and will be future dietitians. So from your side, is there a message that you would like to give to these young professionals on if they would like to become a renal dietitian in the future? What are some of the things that they should be focusing on? Should they be certifying themselves, or should they be educating themselves, or extra courses, or what are some things that you, being in the field for so long, recommend to these young dietitians?
See, actually, it is not only the young dietitians, all the practicing dietitian, we keep update our knowledge. So otherwise, it's very difficult to handle in today's patients, because they Google it and they update their knowledge. So to manage such people, you need to update yourself. So for the young dietitians, especially when it comes to renal, the assessment is very important. I always say to my students, if you are able to assess the patient accurately, the next step and all is very easy. So most of them are making mistake in the assessment only. So there are people, they just come and say that the patient is overweight. If you go and see, there will be edema. So there is a fluid accumulation. So what is dry weight? What is pre-dialysis weight? What is post-dialysis weight? There are a lot of things to learn, and with the experience you can learn. And also there are a lot of, yes, of course, certification courses are there. So for example, the Espanol renal nutrition course, it's very good. So that is also is very good. And also training and everyday updating. Anything new you see, go and search what it is. Knowing the pathophysiology of the kidney and how it affects the nutrition, the connection between this nutrition and the pathophysiology is very, very important. If you learn that, you can successfully manage your patients. So that's what I say.
Thank you so much. That's wonderful. Know your basics. That's very, very important. Yes, we can evolve into.
And also be open to anything good to the patient. For example, I will not say that no supplement I will not at all write. So see if that supplement is beneficial for the patient. So open to any options which is it can do wonder to the patient.
I know it is more inclusive, being more open and receptive to the new technologies and new options that are available out there. I mean, it might every patient is so individualized when it comes to their diet needs. So it is very important to look into all those, educate yourself constantly, get yourself trained. Like Dr. Vijayashree said, there are so many courses out there, and we at NutriHealth Foundation, we are also working towards empowering and educating the young dietitians and nutrition professionals, and constantly trying to get the evidence-based nutrition out into the field, so that we can, as dietitians who have gone through the rigorous training and working in the field, we stand apart when it comes to empowering with the nutrition information than just online searches or these influencers putting out this information that is absolutely there is zero evidence, and it can end up people in more problems than helping them. So we have to advocate for ourselves as nutritionists and make sure that we rally for ourselves, and we have to work in tandem with the doctors, nephrologists and all of the other specialty doctors, and make sure that our presence is felt when it comes to providing the care to the patient. And if any of you need any information on the courses or other opportunities when it comes to nutrition students and professionals, just contact us, NutriHealth Foundation, and then we can guide you from there. All right. Thank you so much, Dr. Vijayashree. And I would like to thank all our panelists from bottom of my heart for being here and adding a valuable information to this discussion on the account of World Kidney Day. I think there wouldn't have been any better day, better way of celebrating the Kidney Day than having this insightful discussion with all of us dietitians sitting together and brainstorming on these important topics. Thank you so much, everybody. And I also would like to thank all the participants who have joined us today from various parts of India and other countries. And I would really like to thank all of you for taking your time and being here with us. Like I said, there are a lot of questions that came through the chat messages and also from our participants. I have a list here, so I couldn't go through each of them right now, but I'm going to, like I said, pass on all the information, all the questions to the panelists, and as soon as we get responses from them, we will circulate to all the participants. Again, thank you so much, everybody, for being with us today. Have a wonderful rest of your day. Thank you, Dr. Vijayashree.
Thank you and congratulations. Almost, if you see, calculate, it is almost 100 years of experience you handled together.
Yes,
So you see,
yes,
Zamrud ma'am and other people are
yes, yes, it is. I know it is wonderful to see so many, eminent personalities in the field and working with so many different kinds of situations and sharing their knowledge. It's extremely important, and I hope the young dietitians and nutrition students that are on this panel discussion, they can get that information and see how important it is for us to learn from all these people like you all and put that into practice. It's extremely important, and I think that's a very great opportunity for them, and we should be thankful. Thank you all once again for being here with us. I'm going to end the panel discussion here today.